Good afternoon. This is Scott Harrow with UMHS Alumni Association, and today we are speaking with Dr. Tess McClenahan, University of Medicine and Health Sciences 2023 grad. And good afternoon and welcome today, Dr. McClenahan.
Thank you so much for having me, Scott. Happy to participate in the interview. It's always nice to kind of have a full circle moment for graduation. So thanks for having me.
Okay, great. And why don't you get started by tell us a little about your upcoming residency that you just matched into. Where will you
Yeah,
be working?
absolutely. So I matched into a categorical 4-year anesthesia program. It's one of the U Massachusetts campuses located in Springfield. I'll be at Baystate Medical Center, which I'm really excited about. It's pretty close to home, I guess, or at least my home base. And so, yeah, I'll be spending the next 4 years there in northern New England, and honestly, really couldn't be happier.
Okay, great. And Dr. McClenahan, what made you initially become interested in anesthesiology?
Yeah, I love that question actually, because I think anesthesia specifically is sort of one of those specialties that you don't get a lot of exposure to. It's not part of the core rotation. So if you think that, you might have an interest in it, it's something that you'll have to do as an elective after you complete your core rotations. I think I had a little bit of an advantage going into medical school. My dad was actually a nurse anesthetist. And so I had that exposure to anesthesia growing up, from his stories and just his experiences. And so in the back of my mind, going into med school, I kind of knew I would probably like anesthesia, but when I went into my 3rd year, I really tried to keep an open mind and went into every core rotation and every elective with, even if I don't end up liking this, I'm going to make the best out of it, and I'm going to try to learn as much as I can from each thing. And there was a couple specialties that, I had a little bit of interest in, but once I scheduled my elective anesthesia rotation, and within the first week, I was like, oh man, like this is it. I was so happy that I found it. Which was definitely a little bit more of a relief because it was coming into my 4th year, and the core rotations, the 6 core rotations that we do, like I said, I liked certain aspects of each one, but it was never something that I saw myself going into each of those 6. And so when I got into anesthesia, it was like, oh man, like finally I found what I wanted to do and kind of what I wanted to match in. And so yeah, I ended up applying for anesthesia. I think it's just one of those specialties that I'm definitely going to be biased when I talk about it, but I think it has a lot of good things about it. It's very procedure heavy. You get to quickly connect with patients. No ordinary day, really. So, yeah, like I said, I really couldn't be happier that I found my home in anesthesia and found my residency spot.
It's interesting that you mentioned not an ordinary day, but do you have any idea if you could just describe what might be a typical day for an anesthesiologist, just for people that aren't really familiar with the specialty?
Sure. So there's a lot of different avenues within anesthesia that you can take, but let's say you're working in the hospital setting, in the intraoperative setting. Your day would start, even as some people might know this, before some of the surgery residents or some of the surgery attendings come in, because you're the person that's with that patient first. And so you need to prep the room, you need to go in and drop all your medications. You need to review the patient's history, make sure that there's no contraindications to any of the typical medicines that you would use in that intraoperative setting, making sure that they don't have any allergies to some of those medications, and, just getting everything set, ready, prepped. The saying in anesthesia is, you can never be more prepared. Like if you're preparing yourself the best, then the chances of there being trouble is less. So prep. Then you go and talk to the patient, and your day could vary from doing an orthopedic case from like a knee replacement to maybe an OB-GYN surgery with a hysterectomy, and then maybe there's an add-on appendectomy at the end of the day, and in between then you're doing regional blocks on that knee that you did, that you're going to want to do a block on that person for some post-operative pain, so they go home as comfortable and as easy going as you can. So, and then, you can do blocks throughout the day. Like I said, you might be on the OB floor doing epidurals for delivering mothers. So really just depends on the setting that you're in. But I think that's what kind of drew me a little bit to anesthesia in the first place is, you're not just doing one type of case. You're not just doing gallbladders or you're just doing knee replacements. You're getting all of those all the time. So.
Right. So it really runs the gamut, it sounds like. What would you say, why is anesthesiology such a competitive area of medicine?
Yeah, like I said, I think I'm going to be biased again here, but I love the autonomy that you get. I love sort of the variation. Like I said, you're not just going to be doing the same surgeries that if you're a surgeon that specializes in this one area, you're not just doing those surgeries all day, every day. And you're with patients in a pretty, I don't want to say scary, but a very vulnerable time in their life, right? Like
Yeah.
they're most likely scared, and to for you to be that person that can just sort of give them that reassurance and just say, like, I am well prepared for you, I'm well prepared for this, and I'm going to try to make this journey into your surgery the most like happy and healthy for you. And yeah, so I think that you get a good work-life balance, you get that variation. I think more and more people are starting to figure that out, and well compensated as well for the time that you do. So it used to be that anesthesia was kind of a hidden gem, but now more and more people are kind of figuring out that you can kind of have it all in anesthesia. So I think that's why it's gotten a bit more competitive over the last few years, especially.
Wow, and that's great to know. And whenever you applied to med schools, why did you choose UMHS over others?
Yeah, so I actually had first applied to some USMD and DO schools, and while I had some interviews through those avenues, I had a little bit of a non-traditional path into med school, and so I think that played a little bit of role into, it just didn't work out, and I was at the point in my life where I knew for certain that med school was something that I wanted to do, and I wasn't going to stop until I got to the end goal. And so when I applied to UMHS, I had gone to a couple of their prospective webinars. And actually, one of the student alumni speakers was Dr. Michaela Troughton, who is a practicing
Oh, oh yeah.
anesthesiologist now. And so just listening to hear her experience and kind of shed some light on UMHS. It was something that I just felt really strongly to apply to, and I have no regrets. I, applied a few months before I started, and just there was no waiting game with it. And I was like I said, this is what I wanted to do, and I wanted to get started as soon as I could. So
Yeah, and I know Dr. Troughton right well, very well. She's actually done some webinars for us. She's really an amazing person. What would
yeah.
you say to a UMHS current or prospective student who is interested in going into anesthesiology? What would you say to them?
I think that my advice for anesthesiology is probably pretty generic as far as the advice that I would give to anybody going into any specialty. There might be, a couple of specific tidbits of advice that I would give for someone for
Mhm.
anesthesia, but really it's just soaking up as much as you can in your time in medical school, both in basic sciences and in clinical rotations. At the end of the day, I hate to say it, but step scores really do matter as far as
Mhm.
getting your foot in the door for interviews. And so you're not going to learn everything that you need to know within your lectures in basic sciences. And you're not going to learn everything that you need to know in your day-to-day clinical rotations in that short, 6-week or 12-week rotation, whatever it may be. And so it's really just being accountable and network. Absolutely, networking is huge. You need to do well in your exams, and it's just really soaking up every opportunity that you can get to give yourself the best chance at being successful in anesthesia or any specialty really that you apply for. I think that's those are the really two big things would be networking and step scores. So
Very, very good advice. Very good advice. Is there anything else that you'd like to add that we haven't covered, whether it's about your specialty, anesthesiology, or about UMHS? Anything else?
I think I kind of covered it a little bit in the last question, and I hope that that sounds more motivating than it does of a warning. But yeah, just really making the most of your time, and your experience is going to be your own. Nobody is going to give anything to you. I hate to say it, but especially at a Caribbean school, you have to work a little bit harder, and you just have to accept that and take that almost as a challenge, that it doesn't matter what school you go to. If you want something, you're going to work your hardest towards it.
Okay, great. All right. Well, I want to thank you so much for your time, Dr. McClenahan, and I wish you the best of luck in your upcoming residency. Okay.
Thank you so much.